Thank you for joining me for Supervision in Context, an ecosystemic perspective. This is a presentation that I offered at the Excellence in Mental Health virtual conference sponsored by the Center for Children and Families. Now, in this presentation, I go into how we can help our supervisees and the perspective that we can have that looks at the context and the social ecology surrounding the practice of supervision. So I hope that this is helpful for you. Let's jump in. And I want to talk about supervision in a very broad context. That's a little bit of foreshadowing. But for me, thinking about supervision, it's much more about the whole perspective of supervising someone as they develop, right? Not just in terms of the clinical approach, which that is important, and that's sort of the bread and butter of what we do, but there's more to that for me. And so as you think about, supervision, what's the thing that comes to mind when you think about what does it mean to be a supervisor? What are some of the things that come to your mind? What comes to your mind? Just pop it into the chat, like first things that come to your mind: gatekeeper, someone that's educating, support, a leader, overseer, mentor, leader. Yes. Yeah. A shepherd. Yeah. So for me, this idea of a supervisor and what it means to be a supervisor comes down to this ability to be able to guide someone, to be able to step in, to use wisdom, if we've gained that, to help someone along the way, to be able to step in at times to help steer them in the right direction or keep them from going into the ditch. And I think about that for me as like, who have been those people in my life that have done that? And for you, think for a second, take a moment, take a breath. I know we've been pushing hard for the last couple of days, but take a moment and think back through your life, the experiences that you've been through. Who have been the people that have stepped in to be your mentor, to be your guide, to offer that wisdom? It's a wonderful thing to be able to think back through your life and to recognize those people that had been there for you when it was difficult, when you needed that guidance, when you were learning. That model, that teacher for you. And so that's kind of what I want to start with. I want you to have those people in your mind as you think about moving into the role as a supervisor. And I do think that we can think about someone as a supervisor, not just in a clinical sense, but also, in a life sense, and I don't want to blur the boundaries. We'll talk about that a little bit. But for those of you that may not be in a position where you're a, LPCS or an LMFTS or a social work supervisor, but maybe you're in a role in the community where you're supervising. Maybe you're in a position of, you're a site supervisor or administrative supervisor over other people. Maybe just a peer. Maybe you're in supervision. That's another thing. It's like, how do I walk this journey as a supervisee? As well, what kind of things do I need to be getting from my supervision? All of those things I think are important for us to kind of talk through. For me, I don't know if you've ever read The Gift of Therapy. If it's not a book that you've read before, I would encourage you to do so. I love this book. I taught from this book in one of the courses that I taught. But here's a quote from Yalom: "Psychotherapy is a demanding vocation." And we've just come out of a presentation that was talking about that kind of demand and the strain and what we need to do about that. And the successful therapist must be able to tolerate the isolation, the anxiety, the frustration that are inevitable with the work. Have any of you ever felt that? Any of those things, that sense of isolation, anxiety, frustration? Anybody feeling that today? Yeah, a little anxious. I am. I'm feeling a little tense, y'all. I'm having to present. But yeah, so the vocation of therapy is tough. We know that. And certain contexts are even tougher. Say if you're working at the Center for Children and Families, you're working with families in crisis, maybe that have gone through really significant sort of trauma, children that have been through trauma, and you're hearing those stories. And that residue, you can't shake that off. That comes in, you're in contact with that. Maybe you're in an inpatient setting where it's very intense work. Maybe you've got, codes that are happening where you've got to respond to crisis situations on the floor where you're working in an inpatient setting, and it's tense and it's scary. There are things like that. And sometimes maybe you're working out in home, like many of our clinicians do, and you can feel isolated. Maybe you've had to drive an hour or more to see a client and you're just in the car. It's It's like, and dealing with that isolation is tough. And so think about that, sort of the experience of what it is to be a therapist, and then juxtapose the importance of that guide, that mentor, that supervisor in the life of a therapist as well. One of the other things I wanted to share is that, Virginia Satir, and I don't know how many of you have studied much of her work, but who she was wonderful. If you've seen any videos of her doing work or supervision, and she was really one of the first supervisors in family therapy. This is one of those things where, she kind of gets not the credit that she is due for being one of the supervisors for one of the MRI early group that was doing the work that started some of the family therapy field. She was there as the supervisor in a lot of that work. And she says, "What I want you to get excited about who you are, what you are, what you have, and what still can be for you. I want to inspire you to see that you can go far beyond where you are right now." And think about that as we step into the role of a supervisor or a mentor or a guide. That's kind of what we hope for in that. We want people to be able to see the qualities that they have, who they are in full, whether the good, the bad, the ugly. That's the other part of it. And that they can continue to move forward far beyond where they are right now. So what is an ecosystem? Think about it in terms of an ecosystem. And I found this fun definition that may or may not make sense to you, but it's a functional unit or a complex of relationships in which living organisms interact with one another and their physical environment, forming a dynamic system. And that's a bunch of words to say that we are just interconnected. That's kind of an oversimplification of that, but interconnectedness of everything, of us as people, with each other, with our communities, with the agencies that we work, the systems that we're a part of, the culture that we come from. All of those things are interconnecting. But the fun part for me is that word dynamic. That dynamic means it's constant movement and shifting. Okay, so as we move, the whole system is dynamic and moves in relation to us. Okay, and so an ecosystemic approach constantly emphasizes that interaction between the individual and that larger system, that family, the larger context in their social system. We're constantly sort of driving towards that. So think about then an ecosystemic approach as it relates to supervision. Okay, so here on the right side of your screen is a little bit of a clip of what my mind looks like. And yes, it is a 90s screensaver. That's what's happening in there. So you think about it in terms of the client is there, the clinician, you as a supervisor, and you kind of can form this triangle, right? This dynamic triangle, as you interact with a clinician, talk with them about how they're relating, what's going on, that shifts what happens with them and the client, which then might shift what happens with the client and the community. You interacting with the clinician may also change what happens in their agency in some way. So there's this dynamic movement that's happening as we interact with each other. And it's easy to think in terms of triangles, because that's one way our mind can kind of process those things. But think about them as we talked earlier about the interconnectedness. So all these interlocking triangles that are kind of knitted together to make this net. That's how my mind kind of works. That is dynamic and constantly shifting. Okay. And so that's what I mean by thinking about supervision in terms of an ecosystemic approach. So this dynamic movement, we're constantly looking at how are we connected and interconnected with the larger context that we're a part of. Okay. So who then is the client? As I think about it, we want to impact the entire system. We want to impact the entire system, because when we work with a kid, say a kid is come to us because they're acting out and things are happening at school. Maybe they're fighting at school, and so we can focus in on just specifically trying to change that behavior at school. But if we don't address, like, hey, what's going on at home before you get to school? What's going on your way home from school? What's going on in the community around you? What's happening in the context of the school itself? Like, are there things going on at the school system level that are not great, that are leading to that sort of kind of behavior? And so you want to think in terms of the whole system. Now, ultimately, you're right. The person that's there, that's coming to be seen, that's the one we want to have the impact in a positive way, but we have to interact in such a way that the whole system begins to change. Okay. And now I want to give you guys a little bit of a history of the Center for Children and Families. I'm not going to dive too deep into this, but a little bit of the history. You know, my first job at the center, we were doing in-home therapy for kids that were involved with juvenile justice. And Ms. Sanji Tarver, who is on this call, was a family advocate working with me. And we were a team going out into the community working with kids that were referred to us because they were a part of that system. And it was new to a lot of the areas that we were working. One, they were not necessarily interested in meeting with us. And two, the people that were referring clients to us didn't necessarily think that we were actually going to be helpful to clients. We had, probation officers were the ones sending us clients. A lot of them did not feel like therapy was what these kids needed. We heard statements like, these kids just need to be locked up. This is your tree hugging social workers aren't going to make any difference. Those kind of statements were coming out about, the work that we were trying to do. And so for us, it was a challenge. We were sitting down. Wendell was a supervisor at that time for us doing clinical supervision. And Wendell's approach started to seep into us about, hey, how are we going to interact with these clients? How are we going to interact with these probation officers in such a way to give them the best opportunity? Because we could do a lot of good work with a client, but a probation officer might already have their mind made up what's going to happen with this kid. So we had to treat the whole system as the client. And so we endeavored to change even how we talked about the probation officers. We started thinking about, okay, what makes sense that this particular probation officer has that sense that this isn't going to be helpful. Well, they've seen a lot of stuff, and they've got a bunch of cases that they're trying to see, and they're run all over the place. And the juvenile justice system is chewing them up just as much as it is the kids that they're seeing. And so we started to interact with those probation officers in a way like, how can we help you with your job? What are things we can do to make it easier for you? And we started meeting with families, not focusing on necessarily everything that was going wrong with those families. They were impoverished, difficulty in schools, all kinds of things going on. We started to interact with them around the things that were positive in their lives. What are the things that they had, looking at resources that they had and engaging with them in such a way that wasn't judgmental, that didn't put them down, which was a difference from how they had been treated by many of the interactions they'd had with the system. And over time, people in the community started opening doors a little bit more frequently, I would say. Still get no-shows. That happens. It's going to happen. But they're more likely to meet with you. They're more likely to tell their friend down the street, hey, this person is a good person. If they come knocking at your door, they'll help you. They care. So those kind of, that word of mouth in the community started to take shape. And with the probation officers, we started to see the relationship change. And they started to see the difference that we're making, and that we kept showing up, and that we were trying to make their lives easier, and we were communicating better, and all of those things started to happen. And so the relationship with our probation officers changed. And that started in the supervision, trying to troubleshoot, what are we going to do different? How are we going to interact so that these kids have a chance? What are we going to do so that we can actually accomplish what we set out to accomplish? And it took us taking into account the whole system that they were a part of. So I want to shift now into some core functions of supervisors. And this is for you guys to think about, just to kind of break down into some buckets, some domains for us to think about supervision. And for me, I want to interweave that ecosystemic perspective throughout this. All right. And so I'm not going to be talking about how we apply that ecosystemic, but you're going to see that I'll weave it into these core functions, because we've got to hold those things, multiple things in our heads at the same time. And so for me, one of the principal things that we do as supervisors is skill development. We want to learning and applying clinical approaches and techniques. And that's with any kind of supervisory relationship. The primary goal, the first thing up on the table is, can I help you become more competent? Can I train you? Can I help you learn what you're supposed to be doing? The next thing for me is professional development. When you're working with newer professionals or folks that are coming into the profession, like really helping them navigate the professional aspects of working in an agency or a setting or with community partners, whatever the setting they're in, they're gonna have to navigate those professional relationships. And that isn't something often that's taught in graduate schools. Right, that's not something that's taught. It's not covered. You have a professional issues class, and maybe they talk about the steps for licensure, or that you need to take this exam, or that sort of thing. But they don't talk about, how do I talk with my supervisor when there's conflict, right? They don't talk about how do I navigate this partner relationship where they won't return my phone call. you know, we don't talk about those things in our graduate school. So you as a supervisor can help that new professional learn how to navigate those sorts of things. Personal development is something that's also a part of it, and for a purpose. Now, I don't want to bleed over into, because we're not intended to be someone's therapist as a supervisor, but we are there to help them grow as a person so that they can help their clients and improve as a professional. So there's going to be those things that just kind of come up in supervision, where they're going to be working with a client and something's going to be triggered in them, and you've got to be ready to catch them in that and talk through, like, how is that hitting you? Why is it impacting you in that way? And so you've got to be in a position where you understand that that's a part of the role. And then lastly, and this is fun for me, I love this part, is career development. As you're working with new professionals, a lot of them have their mind towards the future. And so helping them sort of set those goals, mapping out action steps and how they can actually achieve them. Because, folks, especially, younger folks, and I have a 20-year-old, I have a soon to be 17-year-old right now. They can have grand plans, huge plans. I'm going to do this, and I'm like, what's the first step you need to take to get there? Okay, let's walk it back. We have to do this with our clients as well, but like, how do we walk it back to those practical steps? Like, my son wants to be a Disney Imagineer. Okay, so I'm like, you don't just show up at Disney, and say, hey, I'm here, let me design something. It's like, what do you have to do? What do you need to be doing right now in high school? What electives do you need to be taking? What college majors are out there that you need to be thinking about? And, and are you ready to tackle those majors, and you sort of mapping those steps out. Now, for me, is he going to become a Disney Imagineer? I don't know. But if he's shooting for that, he's got a plan, like, he's going to be better off than if he was just aimlessly thinking, yeah, one day I'll show up and be a Disney Imagineer, right? The same thing goes for our supervisees. We want them to be working towards something, building those blocks in their career. And then, if the opportunities present themselves, they're ready for them. If other opportunities present, they pivot, and that happened to me in my career. Like, never thought I'd be sitting where I'm sitting right now. That was not in my plan. But the opportunities and the way things changed over time, I was ready for them because I had mentors that were preparing me. So we're going to dive a little deeper into this and kind of give you a little bit more of a framework for those core functions. So skill development. And I've kind of talked about this, so I won't belabor it right now. But one of the first things for me is do I have, as a supervisor, a good understanding of the client population and the context of service and the service delivery for the person I'm supervising? Right now I've got some folks that I supervise that do in-home work, and I've got folks that do inpatient work. That is vastly different in terms of what they can do. The different client populations, maybe they're working with detox or psychosis if they're inpatient, or they're working with kids and families if they're doing in-home work. It's vastly different sort of context. And so what I need to be working on them in terms of developing in them may look completely different. And so for me, that's a huge thing. And so don't neglect that. Don't just think that you can come in with a particular approach and I'm just going to teach you this and there it is. You need to be adaptable to the client population that they're serving. Continue to widen that lens. For me, I like to be focused and goal specific. I want to know and have down on paper, like, what are you working on as a clinician, right? What are the things that you're working on right now? I want to know if it's a specific model that you're wanting to implement. I want to know if there's techniques that you're trying to get better in. I want to have those things down on paper because I want to see us integrating that into the interventions that we talk about later on and everything that we're doing. So making sure that I know and that we're on the same page about what your goals are in terms of your development. And it also opens up the conversation about where weak points are as well. For me also, supervision needs to be progressive. I don't think about supervision as like, this is how I always do supervision with people. I have to think about where are they at in their development as a supervisee, as a clinician themselves. When they start with me, I'm going to be very directive, right? I'm going to give them particular suggestions about interventions and strategies. We're going to get nitty gritty with it, and I'm going to be very directive with folks. And there's an intentionality in that. If someone's coming to you for supervision, it's because they want to know what you would do. Okay, so don't hold that back. It was always frustrating when I was a younger clinician if I went into a supervisory relationship and I didn't feel like anything was being offered. You know, you have skills, you have talents, you have capacities, you have things that you can offer it. They're new, they're hungry, they're wanting to learn. Be directive with them and teach them how you would do it. Role play, that's something that I like to do, and I float in and out of that with my supervisees. Anybody that's been in the supervision with me, all of a sudden will be role playing and you won't realize it, but that's what I do. I just kind of float into that. As they get a little bit more of their feet underneath them, I'm going to provide alternatives. I'm not going to be as directive, but I'm going to say, hey, here's a particular way you could go, and here's another way you could go. What do you think? What do you think would be the best fit with that client, with the situation, and giving them those opportunities to decide and make those decisions for themselves? It's a progression. You see that. And then the last thing is I'm going to be asking more questions. As they come to me with a case like, oh gosh, this is what's going on and where this family's at, I'm not going to immediately jump in and say, you know, okay, this is what you should do. If they've been with me a year and a half, I'm going to start with questions. What's the first thing that you would want to do with this family? You know, what other things do you need to know? You know, those kind of things are the kinds of questions that I would ask to help them walk through that process. Because that's what I want them to do as they get out on their own. If they hit those roadblocks, is to be able to ask themselves those questions. So in that phase, I'm teaching them the questions that I ask myself when I'm doing therapy or when I'm thinking through cases. Be very practical, guys. Talk through how, when, what to say. We as supervisors, we cannot assume that it will get us into trouble every single time. And so talk it through. When are they going to, if there's an intervention that they're going to do, when are they going to deliver it? You know, is that going to be the first thing they walk through the door and blurt it out? You know, or is there a time where they want to do that? Is there particular people that need to be in the room for that particular intervention? How are they going to say it? What words are they actually going to use? One of the things when I've done internships or practicums at universities, when I've taught those, one of the questions that comes in is like, what do I say? You know, what do I say when I get in the room? What if I don't know what to say? You know, so talk it through, give them scenarios that they can kind of talk through, because that's so key. This is for me, I rehearse things in my head. Like I do. If I'm thinking about going into a conversation or into a session or a supervision, I'm thinking things through. How would I say that? Now, does it always go that way and come out that? No, not at all. But having that prepared kind of goes back to the thing that Tony was talking about, Dr. Young. The best thing for a panic attack is to have the medicine in his pocket or whatever, you know. So you've got it in your pocket, you know, something that you can do. And so it brings down that anxiety a little bit. All right, let's see. Okay, so here's some strategies. Yeah, you got to be willing to teach, and I kind of talked about this, but you also have to be open to learn. As a supervisor, I do not know every model like the back of my hand. But if I get someone that's my supervisee that's wanting to learn an approach, I've got to do my due diligence as a supervisor. Does that mean I've got to get nationally certified in that particular approach? No, it doesn't. But I better get trained well enough or have enough of a knowledge that I can help guide them through that implementation. I need to be able to ask good questions or give suggestions on interventions. And so you have to be constantly, seeking out trainings for yourself and developing yourself and your own capabilities as well. So that never stops, especially if you're in a position where you're doing clinical supervision, because trends change in the field, modalities shift. All of those things are dynamic, like we talked about. And so you need to be in the know as much as you can. And a lot of times it's students, it's supervisees, it's therapists that are working at my agency that prompt me to find out about a new model or something I haven't heard before, or to learn something more about a therapy. And so you've got to be willing to do the due diligence to really work into that. Okay. Supervisees have a tendency, depending on their personality, to talk about either things that are going well, like they'll tell you about cases that are just going great, or they'll routinely come in and just tell you about the cases that are just falling apart and they have no idea what to do. You need to know about both. Don't simply focus on one or the other. If I've got a clinician that's coming in just telling me about this great case that they had and everything that went well with it, like, okay, I want to capitalize on that. I want to point out the things I think are going well in that, but I also want to know when things are not going well. And then the same thing is true for clinicians, especially early clinicians. They'll just talk about the things that are challenging to them. You need to develop in them that sense of confidence in their own abilities as well. And so talking about cases that are going well and asking questions, don't just lightly touch those and move on. Really mind those cases as well for things that they can hang on to. And for me, identifying and making overt weaknesses and strengths is critical. And the way that you do that is by modeling that first. Like, as a supervisor, you don't know everything. I do not know everything. I want to make sure that people understand where my weaknesses are, what I don't know, what I struggle with, and even things that I've struggled with in the past that I've kind of gotten better at over time. Like, I want to be transparent about those things. Share your mistakes. One of the most powerful things that I've done as a leader in an organization is share my oh crap moments. Like, you have those moments where, like, I just messed up. I just stepped in it. Oh crap. You would be surprised at how much that helps new leaders feel comfortable, because they're going to make mistakes too. And so the same thing goes in supervision. Share times where cases blew up. I got to witness firsthand a session that Wendell Ray had that absolutely blew up in his face. And I was like, oh gosh, this guy is the director of the Mental Research Institute in Palo Alto, California. And the case just went in the toilet. And so after that, he sat down with me and it was like, let's talk about it, and we processed like what happened there. And so be willing to talk about those things that are mistakes as well. This is critical as well. Observe live or recorded sessions. Talk directly to site supervisors. If you're supervising someone, don't just rely on the word of the people that you're supervising. We want to trust everything that comes out of the mouth of someone that we're supervising. We want to, but we need to verify that, because they only have one perspective. And so make sure that you're talking with it, and make sure that that's overt. Like, hey, I'm going to be talking with your site supervisor. I need to get some feedback from them on how things are going. That also gives you an opportunity to help coach them better in their site if there's issues that are going on there, and give feedback. Critical feedback is important for folks. They need to know where they stand, where they need to work. Okay. So we've talked about skill development. We talked a little bit about ecosystemic. And so now we're going to apply. Okay. And so we're going to think about all this. I've kind of covered this a little bit, but you only get a limited perspective. This is the reason you need to talk with site supervisors and with other people in the situation. A lot of times you get a case report that just has all of these things pressing in on it, limiting it. The modality limitations, agency factors, community influence, culture, all that kind of shrinks the frame of what you're hearing from a clinician. And so you need to be pressing against that, getting information that presses against that as much as you can to widen your lens. You apply that through a theory and then offer interventions. This is kind of the bread and butter framework for me. I want to be pushing against the case report that's just simple and a lot of times just a very short snippet of what a clinician gives you. And I want to be asking about, hey, with the client's perception, I was working with a supervisor and he was talking with me about what happened at school with a particular kid. And he was operating completely from the frame that the client and the client's mother had given him. And I said, have you reached out to the principal or the teacher? No. And I said, well, let's do that. Just get some consent from the parent and reach out to the teacher or in the principal and see what their perspective is. And that might be a difference. So you want to press against those limitations that are being put on that case report that you're getting from the clinician so that you have a better idea of how to filter towards interventions and strategies from there. But this is a simple graphic, but you want to continue to press out because everything is shrinking your frame. Everything that's coming in is shrinking your frame. And so as much as you can push out from that, the better. Professional development, I think, is something that also is critical. If you're talking with someone, and we've talked about some of these things, but understanding the context of the practice setting. And that's not just about client populations and modality, or is it inpatient, or is it, a community setting? It's about understanding a little bit more in depth about that particular practice setting. What's the culture like there? What is their interactions with coworkers like? Is it a team environment? Or are they working in isolation? All of those things matter because they're going to be navigating those situations. If they're working as part of a treatment team and they've never done that before, then you've got to talk with them through how do they navigate that. If they're working with a supervisor, maybe this is their first real job. You thought about that? Like maybe they've had part-time jobs, but this is their first big boy, big girl job. All right. It is career time. And do they know how to navigate that? Are they showing up on time to work? What's the expectations around that? What is that going to communicate? And having conversations around that. What if there is difficulty with their supervisor? Like, how do they talk with their supervisor? There's a lot of times people are very anxious about that. And I was working with someone that's worked in the field for a while. He's still, he's working on his license now. And he was talking about, hey, my supervisor she's texting me on Sundays. And I feel my anxiety raising, for my work on Monday, because she's texting me about the clients that are going to be assigned on Monday, and it's really impacting my ability to be present with my family. And he's like, I think I might quit. I was like, whoa. Have you talked with your supervisor? No, it hasn't even brought it up. So why don't we start there? When we start with, let's talk with your supervisor about, hey, when you text on Sundays, a lot of times my mind gets racing about the clients that I'm about to see, and I'm not able to stay present with my family. And that's really a priority for me. You think you could say that to your supervisor? Yeah, I think I could. Why don't we start there? So just coaching on that level sometimes is necessary, and how to interact with coworkers. Sometimes there's rubs there. How do you interact? Response times and follow-up. This is something that they may not be used to. Like for us at the center, like if it's an email or a phone call, we want you to have responded within 24 hours to that. If you've missed that phone call, respond to it within 24 hours. That's just a matter of making sure that they're communicating that people matter, and that those communications with a supervisor, with a client, with a collateral, like that communicates so much. And so response times, understanding what that should look like, documentation, professional writing. I've been a graduate professor at different times, adjunct. I am shocked, y'all, at the level of writing for folks. And it's just, it takes practice and getting good feedback. A lot of times people, when I went through grad school, I don't think any of my professors really took the time to give me a lot of feedback around my notes, and And that would have been so helpful as I moved into my career and giving that feedback. So, let's take a look at a snippet of a case note, and let's give you some feedback on how do you write that case note in a professional way. Because a new clinician may not realize that could be subpoenaed. A judge could be reading that, or that mother may ask for that record, and then that mother's going to get that. So what do you're not writing for yourself. And when you're writing your notes, you're writing for that external audience, for that client that might be reading it. And then completeness and timeliness, all of that is a matter. Understanding the business operations, to me, this is a matter of being able to help them navigate. For me, I'm thinking about like a clinician I'm supervising right now that works in an inpatient. I have an understanding that the business driver for an inpatient facility is census. It's about how many people are in those beds. And they got, leaders, administrators that are making decisions that are driving towards how do we optimize that. And so that plays out with, we have this many discharges on this day, and then tomorrow I've got like 7 new clients that I've got to, do admits on. Like, in my therapist that I'm supervising is having to deal with that minutia. So as I can educate him on why that's happening and how to navigate that, and even how to talk with his supervisor about like the workload that he's having and all of that, that matters. And so doing some due diligence to understand how do the businesses operate that our clinicians are working in. Do you understand that about your own setting? That kind of thing. Do that work. Personal development. Okay, we're gonna maybe dig in with this one a little bit as well. So for me, you need to understand the context of the person that you're supervising. Do you know them? Are they just someone that's coming into your office and you're talking through cases? And to me, you're not necessarily going to be as effective as a supervisor. You need to know who they are. The first part of my supervisions is not going to be me asking about their cases or how their work week went. First part of my supervision is, how are your kids? How's your wife doing? Her birthday was last weekend. What'd y'all do? I'm getting to know them as a person, as a complete person, and understand their context. I want to know if their grandma has been sick, because that's going to be impacting their ability to serve their clients. And so knowing those things matters to me. And one of the things, if you think back to Dr. Hawkins about being seen and heard and understood, like all that plays into it. So if I'm asking you about that person and they're sharing with me, where they're at, and I am dismissive and let's just talk about your cases, like what happens in my body then? Am I seen? Does this person really care about me? And that matters. That matters in a relationship. And so taking the time to do that. Usually I book in my supervisions that way. I want to make sure that I'm talking with them about more than just the work with the cases, because that factors in. I want to process both clients and work context and how it impacts them as a person. How is it hitting them? What's going on with them? And I want to listen to how they're talking about themselves. And I'll share a story with you about this. I was working, doing supervision with a young lady who was not from this country. She spoke better English than anybody on this call. More proper. She had an accent, but she was not from this country. She was Middle Eastern descent. And she was just starting out as a therapist. And she was so worried that people wouldn't connect with her. She wouldn't be able to engage with her clients. And she was talking with me about how to minimize or reduce that impact of her being from another country. And I was like, oh, no. Like, embrace that part of who you are. It makes you interesting. You're wanting to engage clients. What's more interesting than life experiences from someplace other than in this country? What gives you better maneuverability to ask questions that maybe I can't ask because you're from a different culture altogether? Like, embrace that. And she did. And clients loved her, absolutely loved her. And she was able to maneuver in that. And she later told me, it's like, that was so important for her to hear me as a supervisor say, because she was able to be her full self in sessions from there. And so embrace who you are. So listen to how your supervisees, your clinicians are talking about themselves. How are they seeing themselves in relation to the work that they're doing? And how can you help to shape that in such a way that they can be more authentically who they are and utilize their best strengths in that? Now, does that mean that we don't need to change? Absolutely, we need to change. I need to continuously change and get better and improve as a person. But I also want to be honest and authentic about who I am and utilize those strengths as well. So listen to how they talk about themselves. Establish and define a purpose or personal mission. Help your supervisees be intentional about who they are becoming through their work. This to me is very important about a sense of purpose and mission, because burnout is such a clear thing. We talk, if you take that Yalom quote early on about how difficult this work is, man, oh man, when you get into it, if you don't have a sense of purpose and mission, it can be really hard to stay in the grind. If you know what I mean, it can be really, really hard. But if you can recenter yourself on what it is that is your core purpose, and I'll give you an example of this. I was working with a clinician working in a crisis team, and it's like we get them for like 2 weeks or less, and like, how much time do I have with this family? What can I really change? Can I really have happen? And we started to talk through this idea of what is their purpose in that moment? How does that fit within who they want to be? And it completely changed the perspective of what they were doing with their crisis work. It wasn't about, I've got to see this miraculous change. It's about, I needed to be there because I need that client to know that someone cares about them. I need the client to know that there's someone that's going to be listening to them, that cares about them, that's going to help them get a plan together, because that's what I needed in my own life. That's one of the things I do is you dig into purpose and you ask the question, why is that important to you? Why does that hit you so hard? And then you start to uncover the layers of why someone is actually in this field to begin with. And if they can hold on to that, they can ride through a lot of difficult times, right? So I am in this because someone did that for me, or that's what I needed, someone to listen to me, and I want to be that for someone else, right? And so having that sort of core purpose be central, and knowing that as a supervisor opens up doors for you in terms of how you coach and talk with your supervisee. If you don't know that and you're supervising someone right now, have that conversation. Why are you doing this? Why is this so important to you? Dig into those things, because that's their core motivation. That's why they're in this field, and know it at a deep level. Help them develop those self-care strategies and follow up on implementation of them. One of the things I think is very important is can talk through things that are great that I need to be doing. But am I going to do them? I don't know. I need to do a lot of things, but I need to get more sleep. I need to exercise because I have fallen off that wagon many years ago, and I need to get on it because but am I actually doing those things? As a supervisor, you're in a position of guiding and leading, and you can hold them accountable. Are you taking care of yourself? Now, will they do it? Probably not by your next supervision meeting. It's not going to happen, but they'll continue to hear your voice over and over again. And then as time moves on, they may start to develop those habits, and you can keep pressing in on that. Don't give up on that part of it, even if they're not following through. Still hold them accountable to it, because it's so important. And you got to understand and know when they need counseling themselves and have those conversations, and when to stop seeing clients as well, because there's certain times in your life where you will not be in a place that you need to be serving clients. You need to be focusing on what's going on with you. Sometimes that may be a death of a spouse or a child, or something tragic has happened in your life, and you need that time. You're not in a place, as much as someone like me would be wanting to just dive into work because that's my crutch. I would need to stop, and I would need people to look at me and say, no, you got to stop and take care of yourself. So you have to be willing to be that person for them in those moments as well. And like I said, know your supervisee as a person. We start there, we end there. That's the way in which I approach things. And the last one for me is super fun. The career development side for my clinicians as a supervisor, I want to understand the wider context of the mental health field. I want to know the trends, what's happening, so I can guide my clinician in like making good choices about what they're doing with their careers. And so, not that I'm making those decisions for them, but I want to give them information, and I can only do that if I'm staying engaged. Going to conferences like this is a way to do that. You're staying engaged with the field. You're wanting to understand what opportunities are out there so you can present those. That's one of the things for me, and this idea of career development is to present opportunities and options. Help them set their goals, like talk it through. What do they want to do? And then walk back those action steps like we talked about earlier. And then help open doors. As a supervisor, it's one of the greatest things that you can do. As you've got a clinician that is wanting to move into a certain area or get an opportunity, you've been in the field longer. You have connections. You can make phone calls. You can write recommendation letters. Those kind of things are just awesome to be able to do, and help them build those relationships. Introduce folks, be a networker for them. They're new in this field. They don't have those connections, but you do, and you can offer that help. And that's huge. This is a framework for not only sort of thinking about supervision as a whole, this is also a framework to think about supervision on an individual level, like in a supervision session. I want to be hitting on all four of these points. When I'm on my game as a supervisor, I have hit on all four of these domains in the course of a supervision session. My tongue is getting tied up late in the day, but I want to hit on every single one of these in a session. All right. Clinical knowledge, professional competency. The last thing there that's listed is personal character. And this is about your ability to step in when needed. That is what it takes sometimes for us as supervisors, is to be able to say, hey, like we said earlier, this is a time where you probably don't need to be seeing clients, to step in and say, hey, this isn't going well. Do you have the personal character to be able to do those things and move into those hard conversations? If you're going to be asking your supervisee to go have a hard conversation with their site supervisor or administrator, you got to be willing to have those conversations too. That goes back to what Dr. Faker and Dr. Shelby were talking about earlier today. We can't take our supervisees further than we're willing to go ourselves as well. So guys, as the many roles of a supervisor, you're going to be a teacher, a mentor, a leader, a gatekeeper, a coach. There's going to be so much that you can get out of being a supervisor. If that's something that you're doing or that you want to do in your career, it is one of my favorite things. Thanks for joining me for Supervision in Context, an ecosystemic perspective. Hopefully you found some great key takeaways that help you improve your supervision. We've given you an idea of how to think about supervision in the context of its ecology and the impacts that you can have, even wider than just on the clients or the particular clinician that you're working with. And also gave you a framework for how you can conduct your supervision sessions as well. So thank you again for joining me for Supervision in Context.